So, uh, I'm Dr. Fariha Khalid. I think there is no need of introduction. I'm working at Umar Medical Center in evening as a physiotherapist, and mainly it is related to the women health. I have an experience of 3 years in women health physiotherapy, which is related not only limited to the pelvic floor muscles. As I already told you, it also include the perinatal period, antenatal and postnatal period, also the geriatrics and adolescence age. So when it comes to physiotherapy, I just want to ask a question that when you hear that women health physiotherapy, what comes in your mind and what you think? And I want all the participants to write in chat that what come in your mind when you think about the women health physiotherapy. Is there any specific thing like incontinence or just pregnancy that comes in your mind? Then inshallah we will discuss it. So just share your experience that what you think the women health physiotherapy is. Anyone? I will repeat again. I'm asking that any of the participant which will like to share or tell, balki all of you should tell that what you think the women health physiotherapy is. Can you just share? Ji Ummul Seher. What you think the women health physiotherapy is and how a physiotherapist can help women?
अस्सलाम वालेकुम मैम, मेरा नाम उम्मुल सहार है। मैं यूनिवर्सिटी ऑफ कराची से फिजिकल थेरेपी में डॉक्टरेट कर रही हूँ। मैम, मेरा ख्याल ये है कि वुमेन हेल्थ फिजिकल थेरेपी से कि वो फिजिकल थेरेपी जो हम प्री प्रेगनेंसी और पोस्ट प्रेगनेंसी करते हैं। प्री प्रेगनेंसी में मतलब हम फिजिकल थेरेपी के थ्रू ब्रीथ पोजीशन हम सेफेलिक में फिजिकल थेरेपी के थ्रू हम उसको कर सकते हैं। मेरे माइंड में ये है, और ओवरऑल और भी कुछ कंडीशन जिसमें हम फिजिकल थेरेपी यूज कर सकते हैं।
Next participant जिन्होंने hand raise किया, I want you to tell that what is women health physiotherapy. Habibun Nisa. Kindly unmute and tell what the women health physiotherapy thing is.
Assalamu alaikum, ma'am. I'm Habibul Nisa from Karachi University doing pharmacy. So according to me, जो women health physiotherapy के बारे में वो यही है कि it's all about treatment disorder that is affecting the pelvis and pelvis floor. Can you hear me? Hello.
So raise your
Hello, ma'am.
Healthcare is your point of view.
अस्सलाम वालेकुम। मेरा ये ख्याल है कि जैसे हम लोग देखते हैं कि हम ये कह रहे हैं कि पेल्विक फ्लोर या पेल्विक मसल से रिलेटेड है विमेन हेल्थ फिजियोथेरेपी, लेकिन मुझे ये लगता है कि थ्रू आउट द लाइफ स्पैन मस्कुलोस्केलेटल की जितनी भी प्रॉब्लम्स आ सकती हैं वो रिलेटेड होती हैं विमेन हेल्थ फिजियोथेरेपी से, जिसको उसमें हम ट्रीट करवा सकते हैं।
ठीक है, थैंक यू। अच्छा, अब जो है वो आप लोगों ने डिफरेंट यहाँ पे कॉन्सेप्ट्स भी सुने दैट व्हाट कैन बी वुमेन हेल्थ फिजियोथेरेपी इज। सो in women physiotherapy is not limited to the the woman health physiotherapy assistance in his postural guidelines, musculoskeletal related issues. So the anything which can be treated with the physiotherapy throughout a woman life is basically the woman health physiotherapy. There is World Physiotherapy Organization registered, and in World Physiotherapy Organization, the woman health has a special subgroup that it is, for example, we study about the neurology, musculoskeletal, pediatrics, genetics. So in women health physiotherapy, there is a subgroup that it is International Organization of Physical in Pelvic Therapy. It is a main part, but it is not limited to the woman health physiotherapy. So if the World Physiotherapy is enlisting it in a subgroup, then don't you think that it is an important part of concern? So these are the different associations which are registered under the World with Women Health Physiotherapy. So now comes to the Women Health Physiotherapy. Now I will tell you that what is the women health physiotherapy. Women health physiotherapy is not just limited to the pelvic floor muscles. Pelvic therapy is just a part of women health physiotherapy. When it comes in your mind, the pelvic therapy, then pelvic floor muscles are treated through different exercises and they are called the pelvic therapy. That pelvic therapy is limited to the, मतलब आप कह लें कि it is limited to different diseases that can be treated. For example, let's suppose that the pelvis is made up of two hip bones, sacrum and a coccygeal. If there is any issue related to that area, the pelvis, which can also include the pelvic floor muscle, it can also include the symphysis pubis dysfunction. It also include the pelvis area. Then this treatment will be included in pelvic physiotherapy. Next is the obstetrics. Obstetrics mean anything related to the pregnancy, the time of pregnancy, the 40 weeks of pregnancy, and the 6 months after pregnancy or after delivery. The therapy during this time will be included in obstetrics. Then there comes the gynecological physical therapy, which deals with the issues related to the woman reproductive system, which includes ovaries, fallopian tubes, uterus, cervix, etc. And then there comes another area which is also called others, जिसको हम इनमें से किसी में लिस्ट नहीं कर सकते, उसको हमने others के ग्रुप में इनलिस्ट किया है. And it basically includes, for example, if a woman have osteoarthritis or rheumatoid arthritis after the physiotherapy, after a surgery, for example, hysterectomy. Hysterectomy is basically the surgical removal of uterus, or after breast cancer surgery. So there are many different veins which cannot be enlisted in pelvic obstetrics or gynecology. So it is included in other. This is not a standard. You can't say that this is a standard women health physiotherapy classification. It is just for the information that we have different domains in which a physiotherapist can help to improve the quality of a woman life. So we will discuss these points more in detail so you can understand better. So if you are seeing the slides, you can see that this is the pelvis. Pelvis is mainly made up of a sacrum, coccyx bone, and two hip bones. Basically, these four bones combinedly form the pelvis. Two hip bones, sacrum, and a coccyx. The joint on the interior side of pelvis is basically known as, I am highlighting or boxing the area which I am talking about, so you can just link these things. So the joint on the interior side where two hip bones are joining is known as the pubic symphysis. And the joints on the back side are known as sacroiliac joint. So you can see that if there is an issue in the pubic symphysis, if there is an issue in the sacroiliac bone, and if there is any issue related to the pelvic floor muscles. Pelvic floor muscles are the muscles which are present from the pubic area to the coccyx. The muscles which are lining or forming a floor of the pelvis are known as the pelvic floor muscles. If there is any issue related to this, for example, symphysis pubis dysfunction, in which the pubic area become tender and painful. Symphysis pubis diastasis, in which there is separation of this joint. Then this is basically will included in the pelvic physiotherapy. If the woman is suffering from the sacroiliitis, then you are treating the pelvis. Sacroiliitis, so sacroiliac joint is a part of pelvic. So this is not, the women health physiotherapy is not just limited to the pelvis, it includes the different domains. And if there is a pain in the coccyx area, which is also known as coccydynia, the tenderness of coccyx, then this will also be included in the pelvic physiotherapy. So here we are talking about the pelvic floor muscles. Pelvic floor muscles form a floor and they are present from the coccyx towards the symphysis pubis. You can see that this is the pelvis basically, and this is, let's suppose that this is the symphysis pubis. And posterior side we have sacroiliac joint. The muscles present between them basically forms the pelvic floor muscles, and they are not just present in a straight line, they are present in a funnel shape. So basically the pelvic floor muscles have three layers. The first layer is related to the perineal structures which are holding the perineal. The second layer is the urogenital diaphragm, which has the two openings. One is the urethra and second opening is the vagina. And the third, if we talk about the third layer, it is the pelvic diaphragm in which the rectal opening is present. So basically this is the pelvic floor area. And if we talk about the rehabilitation or the strengthening of pelvic floor muscles, so we are talking about these three layers, these three group of muscles, so we can avoid different complications. So basically the if we talk about that, this is a pelvis have organs in it. For example, bladder, the lower part of the intestines, and in women it also have uterus. Through the pregnancy, the uterus size increases as the fetus grows, which leads to an extra pressure on the pelvic floor muscles. And when there is pressure on pelvic floor muscles, this leads to their stretching and weakness. So it is necessary to treat the pelvic floor muscles so further complications can be avoided. So I hope you get the concept that what are the pelvic floor muscles. So here is the three layers of pelvic floor muscle. The layer one is basically perineum is the area which is present between the urogenital diaphragm and the pelvic diaphragm. So basically on the anterior side, this area is the urogenital diaphragm, which contains the two openings. The one opening is the urethra and second opening is the vagina, which is the opening of urethral opening. Then if we talk about the pelvic diaphragm, we have a rectal opening. So basically this is the pelvic diaphragm, and the area between the urogenital diaphragm and the pelvic diaphragm is known as the perineum. So the first layer is basically the layer which is forming the perineum. And the second layer, if we talk about, is the deep layer, which is basically the urogenital diaphragm, as I already shown you. And if we talk about the third layer, it is the pelvic diaphragm. So one more thing come in mind, that what happens if women does not get rehabilitation of their pelvic floor muscles. We think that the urinary incontinence is part of aging, that as the woman proceeds towards you can say the 40, 50, we think that the urinary incontinence is common, but this is a misconcept. Women develop urinary incontinence because they do not treat their pelvic floor muscles. It is not a part of aging. Due to the heavy pressure on the pelvic floor muscles, their muscles got weak, leading to the urinary incontinence. And they think that this is the normal part of, you can say this is the normal part of aging. No, the urinary incontinence is not a physiological process of aging. It is due to the weakness of pelvic floor muscles. And if we can say the weakness of, for example, biceps, triceps muscles can be treated, then why not the weakness of pelvic floor muscles can be rehabilitated? It can be rehabilitated, but due to the miseducation, misguidance, the women take that this is a part of aging and they do not get treated for it. Let's talk about our home, that our mothers or our grandmothers isolate themselves, that they will not go to that place because they can't go to washroom easily. So this make them isolated from the environment, from different external environment. So urinary incontinence is a common complication and is not a part of aging. So its rehabilitation is an important process. So it should be rehabilitated and treated. And to avoid the social distancing, you can say the social isolation. So I hope that you got the concept of pelvic physiotherapy, that what is pelvic physiotherapy. It is related to the disorders related to the pelvic area, pelvic floor muscles, and you also got the concept of urinary incontinence. And pelvic floor muscle, physiotherapy is just not limited to the pelvic floor muscles. Next, if we talk about is obstetric physiotherapy, as I already told you, it is related to the pregnancy. Throughout the pregnancy, 40 weeks, if women have any musculoskeletal disorder, any neurological disorder, cardiovascular disorder, for example, if we talk about the musculoskeletal disorder, it can be different muscle cramps, it can be different muscles weakness, postural guidelines, low back pain, etc. Sacroiliitis, there can be different complications. If we talk about the neurological pains, then there can be a nerve compression syndrome. For example, myalgia paresthetica. For example, TOS, thoracic outlet syndrome. For example, the compression of median nerve, radial, neurosciatic nerve. So there can be a neurological pain or musculoskeletal pain. There can be an issue in the cardiovascular system, as you can see the swelling on the extremities, swelling on the feet. So this is also very common. So to avoid the swelling, for example, due to the varicose vein and DVT, so physiotherapy is an important part to make the pregnancy easy throughout, to avoid the complications and to treat the complications. There is another most common complication, which is the diastasis recti. What is diastasis recti? As the abdomen size grow, the diastasis muscle which is present, which is also known as the ab muscle, six-pack muscle, basically it stretches out, leading to its separation. So the separation, if it continue after postpartumly, then it also need attention. So this is not just a small domain, it is a quite large domain, which cannot be just taught in this lecture. So I am just giving you a brief introduction so you can get that what a women health physiotherapy is. I am not discussing about the treatments. I'm just telling you that women health physiotherapy is a large domain, not just concise to this area. So in obstetrics, we deal with the woman in pregnancy, for example, the 40 weeks of pregnancy, then during the labor period, which is the perinatal period. The during pregnancy period, the 40 weeks of pregnancy are known as the antenatal period. During labor is known as the perinatal, and after the labor is known as the postnatal period. During labor, women can sport, there is different certification for childbirth, but unfortunately it is not common in Pakistan. Immediately after postpartum, women can be rehabilitated to avoid different pains, swelling she have, to educate her different postures, etc. And then there comes the postnatal period, postpartum period, in which different complications, which does not just end when they end with her pregnancy. For example, if diastasis recti continue after the pregnancy or delivery, then this need attention and should be treated. So there are different complications, for example, low back pain, sacroiliitis. For example, the posture of a woman alters after her pregnancy. So these all need attention and these all should be treated. And there is one more important thing, that after postpartum, in the postpartum period, the women's just become very conscious about their weight. They put on so much that they want to lose it. So this is also a part that you can educate her, that how to lose the weight in a healthy way, not just be on diet and all that. You can tell that she can't do exercise till, if it's a cesarean, she can't do exercise at least for 6 months. And if it is normal, then she can go for exercise almost about 2 to 3. And she can't start with just with the direct belly exercises or so. She should just start with the basic exercises. So these are the guidelines that you, being a physiotherapist, can tell to the women. Now there comes gynecological physiotherapy. I already told you the gynecological physiotherapy is the physiotherapy which is related to the female reproductive system. The ovaries, fallopian tube, uterus, the opening of the uterus, which is cervix, etc. If there is any complication, let's talk about the gynecological cancers. If there is any cancer in the uterus, if there is any cancer in the cervix, then after the removal of cancer, the woman need physiotherapy to deal with the weakness of her muscles. For example, to deal with the weakness of pelvic floor muscles. After the cancer treatment, the pelvic floor muscles get weak. So there can be a treatment of this. There can be a treatment of her urinary incontinence also. So gynecological physiotherapy, this is just an example. For example, let's talk about the painful menstruation. It is also related to the gynecological physiotherapy. So there is a large domain, but unfortunately we think that this is a short domain and there is not much in it. But this is the misconception. The women health physiotherapy is a large domain and there are a lot of complications. I am not telling about, you can say that I am not telling their total complications. Then there comes the last group, which is the other. The other group contains the different complications. For example, the musculoskeletal complications. For example, you can say neurological complication, which woman can develop in any age of her life, in her adolescence, in, you can say, her geriatric old age, senile age. So if there are any complications which women develop, so these can be treated. For example, if we talk about a breast cancer surgery, so there is a removal of a part. So after that, women need guidance. So this is also can be treated or rehabilitated through physiotherapy. So there are large areas. For example, osteoporotic women. For example, if we talk about the osteoarthritis, rheumatoid arthritis, the weakness women get after her menopause due to the hormonal changes, these can be controlled. Uh, After the menopause, the hormonal changes leads to the different complications, the weakness of the bone, osteoporosis, etc. If we treat them at the right time, then this can also, you can say, prevent different complications. So this is a large area which need to be treated. So I have given you a brief introduction on different domains, that what a women health physiotherapy can be. So now, what do you think, that is there any significance or any importance of women health physiotherapy? Should we go for it, or what do you think? So there is a significance of women health physiotherapy. As you know, if we talk about health, health is not just your physical health. it is also your mental health. It is also your social health. If there is a circle or hierarchy, you can say, between the different components of health. If we talk about mental, physical, or you can say the social health, then these all three are interlinked. If a woman is a physically disturbed, she have pain, then how you can uh, think that she can be mentally fine, how she can socially interact well. So there is a need of women health physiotherapy, as the life of a woman is different from men due to the, you can say, due to the pregnancy, menopause, menstruation, etc. So the health of women also need a special, you can say, attention, special focus. So the importance of women health physiotherapy is to avoid different complications and to increase their quality of life, as it's the purpose of physiotherapy to improve the quality of life. So I already told you that there is a difference in the life of men and women. So women need special attention because of their, you can say, the pregnancy time period, and after the which they develop different complication. After the menopause, the hormonal changes leads to different complications. So women need special attention for these treatment. So this was the lecture. I want you to tell that how was it and what did you get from it? Is there anything new you got? And if there are any questions, you can ask. Anyone have any question, you can ask. Chat is enabled. You can ask question if you have, or you can share your opinion that if you got anything, learned anything new, and what do you learn from this webinar. No one have any question or any queries? Yes, there is a question that is there any treatment for too much menstrual pain? Yes, there is a treatment for too much menstrual pain, and this is known as the pre-menstruation syndrome. That in pre-menstruation syndrome, before the menstruation start, women have different muscle cramp, different pain, and this can be treated with the physiotherapy, that by using, you can say, by relaxing her muscles, by using TENS for her pain, and by using hot pack, and have light core strengthening exercises. Samiullah Khan, your question is incomplete, so write full question. Yes, you can use TENS during menstruation, not directly or on abdomen. You can use on low back pain, low back area, which is lumbar area. Let's discuss a point. If we talk about TENS, there is a controversy related to it. There is a controversy that if we see in different studies, they say that there is no harm seen of TENS, but this should not be used during pregnancy, as this can increase the uterine contraction, which can lead to premature labor. So during menstruation, it can be used. Don't use directly on abdomen, but you can use on low back. But during pregnancy, there is a controversy that usage of TENS can lead to uterine increase in uterine contractions, which can lead to the premature labor. Physiotherapy can't be the replacement of healthy food. Physiotherapy is needed with the healthy food. Okay, you can't say that the physiotherapy is replacement of the healthy food. Healthy food is needed with physiotherapy. These are two different things. You are confusing two different things. Thank you. So if you have any more question, you can ask. This is a link of my YouTube channel. For more informative videos or related to the women's health, you can subscribe or see different videos. And this is also my Facebook page. And thank you so much for your patience and for listening. And if you still have any question, you can ask. This was the just basic introductory lecture. Inshallah, some other time we will also discuss related to the specific fields, like how we can treat the pelvic area, how we can go through the obstetric physiotherapy during the time of वुमेन हेल्थ फिजियोथेरेपी अगर हम देखें तो दिस वुमेन हेल्थ फिजियोथेरेपी बेसिकली हम सिर्फ समझते हैं कि ये हमारा जो पेल्विस एरिया है उसकी फिजियोथेरेपी है, पर ऐसा नहीं है। हम समझते हैं कि वुमेन की जो यूरिनरी इनकॉन्टिनेंस है, यूरिनरी इनकॉन्टिनेंस बेसिकली जो यूरिन की ड्रॉप बाय ड्रॉप लीकेज होती है उसको कहा जाता है। तो हम ये समझते हैं कि जो वुमेन हेल्थ फिजियोथेरेपी है वो सिर्फ उसकी पोस्चर को अच्छा करने से, या जो हम उसकी बात करते हैं कि यूरिनरी इनकॉन्टिनेंस उसको ट्रीट करने के लिए है, पर ऐसा नहीं है। वुमेन हेल्थ फिजियोथेरेपी हमारे पास एक लार्ज डोमेन है, एक लार्ज एरिया है, एक लार्ज फील्ड है जिसमें हम पेल्विस को जो ट्रीट करते हैं इट इज एन इम्पोर्टेंट पार्ट, बट इट इज नॉट, मतलब आप ये नहीं कह सकते कि ये पूरी वुमेन हेल्थ है। पेल्विक जो फिजियोथेरेपी है वो सिर्फ एक पार्ट है वुमेन हेल्थ फिजियोथेरेपी का। देन सेकंड जो है वो हमारे पास आती है ऑब्स्टेट्रिक फिजियोथेरेपी, जो वुमेन्स को डील करती है ड्यूरिंग प्रेगनेंसी, ड्यूरिंग लेबर। ड्यूरिंग प्रेगनेंसी का मतलब है द 9 months ऑफ प्रेगनेंसी, ड्यूरिंग लेबर एंड, और आप कह सकते हैं कि जो पोस्टपार्टम पीरियड है, पोस्टपार्टम पीरियड जो 6 months आफ्टर प्रेगनेंसी पीरियड है, उसमें जो वुमेन के डिफरेंट कॉम्प्लिकेशंस के साथ डील करती है उसको हम ऑब्स्टेट्रिक फिजियोथेरेपी में जो है वो काउंट करते हैं। उसके बाद जो है वो हमारे पास नेक्स्ट जो है वो आता है गायनोकोलॉजिकल फिजियोथेरेपी, जो हमारे पास फीमेल रिप्रोडक्टिव सिस्टम से रिलेटेड डिफरेंट कॉम्प्लिकेशंस हैं। फॉर एग्जांपल द गायनोकोलॉजिकल कैंसर्स, फॉर एग्जांपल द पेनफुल मेंस्ट्रुएशन, प्रीमेंस्ट्रुअल सिंड्रोम एक्सेट्रा, जो उसको ट्रीट करने के लिए डील होती है, इट इज इन गायनाकोलॉजिकल फिजियोथेरेपी। एंड लास्ट जो हमारे पास आता है इट इज अदर्स। अदर्स में वो हैं जिनको हम इन तीनों कैटेगरीज में काउंट नहीं कर सकते थे, हमने उसको अदर्स में काउंट कर दिया। एंड इट इज बेसिकली ये इसमें बेसिकली वो कॉम्प्लिकेशंस आती हैं जो वुमेन को उसकी एडोलेसेंस, फॉर एग्जांपल 16-17 की एज में या 50-40 किसी भी एज में थ्रू आउट हर लाइफ, किसी भी एज में उसको कोई कॉम्प्लिकेशंस हो। फॉर एग्जांपल अगर हम बात करें प्रीमेंस्ट्रुअल सिंड्रोम की, अगर हम बात कर लें, हम अगर बात करें ऑस्टियोपोरोसिस की, अगर हम बात करें रूमेटॉइड आर्थराइटिस की, की डिफरेंट मसल्स की, नर्व कंप्रेशन सिंड्रोम, फॉर एग्जांपल अ वुमन डेवलप अ न्यूरोलॉजिकल पेन ऑफ sciatica। सो ये सारी जो हमारे पास चीजें हैं इनको हम ट्रीट करते हैं। फॉर एग्जांपल आफ्टर द ब्रेस्ट कैंसर सर्जरी, सो उसमें जो है वो हम वुमेन को आफ्टर अदर्स में हम उसको कैटेगराइज कर दिया। तो आई होप कि आपको इंग्लिश से उर्दू ट्रांसलेशन में थोड़ा समझ आ गया होगा। वालेकुम अस्सलाम। ये जो आपका हाइट के बारे में क्वेश्चन है, तो बेसिकली हाइट जो है वो डिपेंड करती है, मेनली कहा जाता है 18 के बाद भी हाइट बढ़ने के चांसेस जो है वो हमारे पास 21 ईयर्स तक हाइट जो है वो इंक्रीज हो सकती है। तो बेसिकली ये डिपेंड करता है कि आपकी जो बोन्स हैं वो उनमें जो आप कह लें कि कब वो फ्यूज हो जाती है। और अगर हाइट बढ़ाने के लिए एक्सरसाइज कर रही मतलब पूछना चाह रहे हैं, तो उसमें जस्ट हमारे पास जो एक्सरसाइजेज हैं वो जस्ट 1 to 2 इंच हाइट को जो है वो इंक्रीज कर सकते हैं, इससे ज्यादा नहीं। और उसमें भी जस्ट आप कह लें कि आपकी वो स्पाइन से रिलेटेड होती हैं बेसिकली, कि अगर आपकी स्पाइन में थोड़ा सा नेक और उस पोस्चर में आ जाए तो वो आपकी हाइट को जो है वो थोड़ा इंक्रीज कर देता है। Any more questions? Actually, this topic was not related to the treatment. This was just for the, you can say, for the awareness that how physiotherapy can help in different areas or different areas in a woman's life, in different, you can say. So if you are talking about treatment, then there is not a specific treatment. The treatment for even painful menstruation is also linked to your condition, to your history. There is no, you can say, the specific treatment that this is given. As you know, in physiotherapy, the your history is quite important. So उसके base पर जो है वो हम उसको कर सकते हैं. Please don't try it on screen. Of course, physiotherapy can help in reducing knee pain. Physiotherapy can help in reducing musculoskeletal pain, neurological pain, and different kinds of pains. गायनाकोलॉजिकल फिजियोथेरेपी में वुमेन के रिप्रोडक्टिव सिस्टम से रिलेटेड, जिसमें हमारे पास जो है वो उसके ओवरीज आ जाती हैं, फिलोपियन ट्यूब, यूट्रस, डिफरेंट उसका जो रिप्रोडक्टिव सिस्टम है उससे रिलेटेड जो कॉम्प्लिकेशंस होंगी उनको गायनाकोलॉजिकल फिजियोथेरेपी में हम ट्रीट करते हैं. Do you have any other question? There are exercises which can increase the chances of normal, you can say, labor. मतलब नॉर्मल डिलीवरी के जो नॉर्मल वजाइनल डिलीवरी के हैं चांसेस वो इंक्रीज कर सकती है, बट दिस इज नॉट के हम टोटली जो है वो उसको कर सकते हैं. ठीक है, बट देयर आर एक्सरसाइजेज जिसके थ्रू हम सिजेरियन के चांसेस कम करके नॉर्मल डिलीवरी के चांसेस जो है वो इंक्रीज कर सकते हैं. ड्यूरिंग यू कैन से मेंस्ट्रुएशन आपको जो है वो डायरेक्टली एब्डोमेन के एक्सरसाइजेज जो है वो नहीं करनी चाहिए. अदरवाइज यू कैन डू अपर एक्सट्रीमिटी एक्सरसाइजेज, यू कैन डू लोअर एक्सट्रीमिटी विच डायरेक्टली डू नॉट इन्वॉल्व योर एब्डोमिनल मसल, फॉर एग्जांपल क्रंचेस, स्क्वाट्स एक्सेट्रा. These exercises should be avoided during menstruation. Inshallah, next time we will have different, you can say, topics on the treatment, but this was not related to the treatment. This was just related to the domains we have to treat women, the areas of the women health physiotherapy. So I think you don't have any more questions, so let's end this up. और I think किसी को यहाँ पे जो है वो वैसे भी बहुत जल्दी लग रही है. So अगर आप नहीं सुनना चाह रहे जो भी ये write करें, you can just leave the meeting. There is no compulsion that you have to stay. ठीक है, so you can just leave. instead of showing this behavior. So stay blessed, all of you. Allah Hafiz.